Always good. Right. So, welcome back to Dominate Your Day podcast. I'm Dana Williams, and I'm thrilled to introduce you today to Dr. Alan Rozanski. Dr. Alan Rozanski he's got a wealth of knowledge. Today, we're going to really dig deep into well-being. And as a doctor, Alan's recommendations of what he's found in over 40 years of working in medicine, working as a professor, and also working as a director of nuclear cardiology at Mount Sinai. So, welcome to the show. And I can't wait to have this discussion with you. I'm so passionate about where we are right now in the world and how so many people are getting burnout and they just don't know what to do about it. And they just keep getting on that cycle. And we don't want people to have to come to doctors like you. We want them to know about what's going on now so they can prevent that, right?
Yes.
So welcome to the show. And tell us a little bit, Dr. Rozanski, how you got here. How did you, 40 years ago, somebody put a little bug somewhere about you being a doctor? Where did that start? How did you get into cardiology?
Well, I always knew I wanted to be a doctor. And by the way, thank you so much for having me. When I was young, we all looked to my dad, and he was a doctor. And I went to college knowing I was going to be a doctor. And it was all normal, all normal. I was going to be a private practitioner doctor. And I'd finished my cardiology fellowship. And at the end, I was told by my chief of cardiology that there was this new field called nuclear cardiology, cardiac imaging. And I wanted to take advice, so I was able to arrange an elective at a place called Cedars-Sinai Medical Center in Los Angeles. I'm based in New York. And I went out there for a few months, and I thought, I'd get a little training, but I was hoping to see the West Coast. I'd never been there. But when I got there, no one was going to the beach. I didn't know anybody, so they were doing all this research. I said, okay, I'll do some research. I wasn't really into it. But they gave me this project, and it was very good. And it worked out well. And at the end of this, they thought I was so into research, I just had nothing else to do. And they offered me a full-time faculty position. And they said, we'll make you an assistant professor.
Wow.
So I forgot about my life goal, which was to be a private practitioner doctor. And I started doing this research. About 2-3 years into it, I'd already been quite successful in writing papers and whatever, but I was getting increasingly depressed. Because it wasn't me. I wasn't meant to be someone looking at scans and functioning like a radiologist. I ended up listening to this radio talk show. It was like a psychologist talking. And I was just fascinated by the psychology. So I decided, wait a second, maybe I can make an appointment to see him. And I did. And he said the craziest thing to me, because I told him that I felt unfulfilled and I liked psychology. So he said, why don't you call the Department of Psychiatry at UCLA and tell them you want to be the cardiologist? That's what he told me. And I thought it was wacky as he said it. And over the weekend, I forgot about it. Monday morning, on a whim, I called up the Department of Psychiatry. And the secretary asked, what's this all about? And I told her, I said, okay, I'll talk to the chief. 2 days later, she calls me back and he said, Dr. What was his name? I forget, but he told me, go meet with this Dr. Weiner, Herbert Weiner. I said, okay. It turned out that Herbert Weiner was one of the leading figures in psychosomatic medicine in the country, or in the world, actually. So he told me that there was this new research network from the MacArthur Foundation to study health-promoting and health-damaging behaviors. And they were offering a sabbatical fellowship. And it had to be multidisciplinary. And if you have a good idea, you could apply for it. So I went home. And that night I thought of a project, because we in cardiology had developed this ambulatory way of looking at people's electrocardiogram while they were doing daily life activities. And we could pick up abnormalities in function that way. And we were noticing that people were getting these abnormalities in real life while they were driving, doing, kind of normal activities, not like the treadmill testing. And it was occurring at low heart rates without chest pain. We were calling this at that time silent ischemia. Ischemia means lack of blood supply. And I said, wait a second, maybe we can study this in a laboratory. Because what you do as a nuclear cardiologist is you have people exercise on a bike, and you want the wall motion of the heart to move more with exercise. But if one of the walls slows down and stops moving, it says there's obstructive heart disease, coronary artery disease that's causing that. And I came up with, wait a second, let's study this during mental stress and see if this could happen. So I went back to Dr. Weiner. I told him the idea. He loved it, but I didn't know how to do the project. So he put me in touch with a few psychologists, and they all said the same thing. You have to use a battery of tests. One was like serial subtraction of sevens. Another was a kind of video game stress. And the third was just ask patients to talk about the stress in their lives. Just talk about the stress. The second patient we're doing is a 59-year-old man who was about to lose his job, and he had heart disease, and he was very worried. He had teenage kids. And we asked him to talk about this. And as he's talking, we're monitoring his heart, looking for the wall motion. And about halfway into his 3 or 4 minute speech, literally half of his heart stopped moving.
Oh my gosh.
Yeah, about half. And then when he stopped speaking, it came back. And then the same happened during exercise. We did this in 40 patients. About half of them developed these abnormalities, and only with the speaking task, essentially. So in other words, just speaking about the stress in your life, if you had heart disease, was causing these abnormalities.
Interesting.
This, by the way, has been reproduced in about 25 subsequent studies. That was my aha moment. That was my introduction to mind-body medicine, and I couldn't walk away from it. So from then on, I just began to study what is the relationship between stress and other factors in heart disease. And it's been a 40-year journey, and I developed a whole health model based on it, including things that I think are relevant to your audience and the people who have burnout.
It's so interesting as you share this. This was 40 years ago that
Yes,
you're sharing this story.
yes.
And I love how you got from New York to California, just thinking, you might go to the beach and you might. Did you ever go to the beach? Did you ever get there? Is my
Not too
question.
much. I was one of these workaholics. And
Uh-huh.
the weather got better and I was into this stuff. I went to the beach, of course, but not as much as I should have.
But you were working yourself, and you were seeing a correlation between when people were speaking about stress and their heart changing. What has changed since you started that first original study, and what are you seeing now? There's, with the advent of so much technology, so much AI, so many things happening, the amount of news coming to us all the time, and then seeing what's happening to the health of the human body through all this burnout and stress.
Well, many things have changed, including things which make it a little harder to be healthy,
Mm-hmm.
and certainly more stress that we have. But why I think I'm able to talk about it is that I learned early on that I don't have to come up with ideas or models, but we could use the body, the study of the body, to testify as to what's healthy and unhealthy. Basically, those things which protect your physiology, decrease the risk of disease, and promote longevity are healthy. And those things which do the opposite, like smoking, which damages your physiology and shortens lifespan, are unhealthy. So I began to study, hey, what are these different things? I discovered, well, there's these physical factors, exercise, resistance training, sleep. That's one domain. Turns out, though, your emotions are very important. When people become depressed, the physiology of the body goes haywire. You develop insulin resistance, you develop heart disease, the brain gets adversely affected. The quality of your thinking. You learn that optimists live longer, pessimists live shorter. So that's your third domain. The social domain is huge. Even if you take social animals and you put them in cages, they develop heart disease. There's a whole area in terms of how you manage stress. But I think the one most relevant to your audience, and the one excited me the most, is that your very sense of life purpose has a profound effect on your health. And if you're achieving your sense of life purpose, if you're clear on it and you're on that path, you have a greater sense of vitality. And when you don't, you actually lose vitality, you develop more frustration. And the amazing thing is you develop a greater risk for heart disease and other chronic diseases. So there's this link between our sense of purpose and our health.
Wow. And so there's a lot of people out there, they're thinking what they're doing is supposed to be their purpose, but they're doing it because somebody else told them that. I love your story about how you started off saying, I want to be a doctor. And then you went on this path with the research and then into now what you're doing to really help with evidence-based
Right,
studies. So that became, you lit up probably as that purpose started revealing itself to you. And
right.
here you are. Yeah.
Exactly. Yeah,
And so how, I think one of the things that I love to do with leaders is help them find their purpose, unlock it. We use Clifton Strengths as one tool, but what are the tools that you help your patients with as they're trying to figure out their purpose? And how have you found a difference in their health once they find their purpose?
very good question. So first you have to make sure that your ladder is up against the right wall, right?
Yeah.
Because if you're climbing the wrong wall, you can
Mm-hmm.
exert a tremendous amount of energy and so forth. And many, many people actually don't have the ladder up against the right wall because we
Mm-hmm.
start off in life with, you know, different influences which got us going in terms of, wait, I'm gonna do this because my parents influenced me or my friends had an influence, or this was the thing that people do. But that isn't necessarily the kind of inner thing that you were destined to do. So
Mm-hmm.
how do you get at that? So one of the things I suggest is what I call tuning fork moments. Tuning fork is like things that resonate with you. So
Mm-hmm.
tuning fork moments are those kind of moments when you were doing something, you had that sense, gee, this is me. Time stopped. You were enthralled by it. You were fascinated by it.
Mm-hmm.
And well, maybe by example to show you that when
Yeah.
I was in college, the only course I remember is I took a course with a Dr. Mail, I think was his name. He was a psychologist, and it was a class on personality. And we had to, for a semester, it was only 12 students in the whole seminar. And we had to interview two other students per week, write up our, analysis of them, have them keep dream diaries and something like that. I was so fascinated by that experience in that class, and I looked forward to it. I practically couldn't sleep the night before. And that's a tuning fork moment. There was something about studying how people tick in psychology, which was very interesting. And I actually went to medical school wanting to be a psychiatrist. And then I discovered I loved cardiology. But then my training and everything thereafter made me completely forget that I had this kind of tuning fork experience until by accident I got back involved with it when I went to see Dr. Weiner. And by the way, just in those car rides when I was listening to psychologists, that was a tuning fork moment too, right? I was resonating with the interest in that.
Mm-hmm.
So I tell people, try to recollect your tuning fork moments and then see if there's a pattern in it. See if there's something within it that gives you a sense of what might be your life purpose. So that'd be one tool.
So
Okay.
when you think about these models and these domains of health that you're talking about, it's interesting that you bring up emotion as well.
Right.
Um, some people are highly emotional. That's their kind of DNA, right? They're just
Right.
going to kind of be excited or they're going to be down. Some people are going to be your optimists. They're just always cup half full. Um, how do you treat people who you see through these domains? How do you help them take better care of their health, especially their heart, when they know, okay, this is the way I typically am thinking about the world in your psychology, because what I hear is you're really connecting the head and the heart here, with your psychology and
Yeah.
then cardiology, right? So
Yeah.
how can you share with us some moments, maybe not a patient, I don't want to hear a patient's name, but a story where you've helped somebody understand it and get their health in a better place? Like the man you were talking about that was 56, that was having some stressful moments. There might be somebody else that you've helped in one of these domains and helped him get on the other side of that.
Sure. Well, as you were asking the question, about 3 or 4 things showed up, but then one floated to the top.
Oh, good. We like those.
It is the master foundation piece to your answer. And I'll tell you that I did get that sabbatical fellowship. When I came back to Cedars, I had the opportunity to start the preventive and rehabilitative cardiology program. So we're taking patients who've had heart attacks, and many often they're frail and they're in their 70s, and we're putting them through a rehabilitation program. And many of these patients are depressed and they're certainly anxious. I would see during this 12-week program 3 times per week where we put them on these treadmills at the lowest speed possible. And some were very anxious to be on it. And the transformation from getting physically active was profound. So when you get into whatever you're doing, when you put being physically active at the core, it improves your well-being, not just physically, but also emotionally. In fact, a dear friend of mine, Dr. James Blumenthal at Duke, who's been there for many years, he's a psychologist, but very evidence-based research, had 3 NIH studies. These were randomized control studies, taking people with depression and randomizing them to an antidepressant medication or to exercise. And they were randomized, so that's the highest level of research we can do. And at the end of the trial period, there was the same level of decrease in depression, whether you had gone on an exercise regimen or an antidepressant. And we know from it now a tremendous amount of research that exercise improves moods, increases vitality, decreases depressive thinking, and so forth. So that's the place to start.
Wow. And that, it sounds so easy. It's just getting in that habit, right? It's getting, I think a 12-week program you're talking about, it was, they had some accountability. We have a lot of people right now who are suffering from loneliness. They might not have that neighbor or that person to walk with or that person to exercise with. And it's helping them get that accountability, or even if they're in their, I guess, what is the youngest you've treated for heart disease or heart and that you've been able to help change? Because I'm thinking, we're talking right now about 70-year-olds, but there's probably, I know of a few people in their 50s and 60s that have had heart issues.
Right.
With stress and things like that. But it's like, what are some of the remedies as you encourage them to go get exercise? We know community is important. We know that is a huge piece of this, of working out with other people and having that accountability. I know I have to do that. I have to find somebody, to go work out with, because I'm that social kind of person. But for those other people, they're kind of isolating. What do you recommend for them?
Yes, well, 2 things I think come to mind with this specific question. One is just to put out there that although people are older, that we're generally seeing as physicians, and disease increases with age, health is something that's a determinant to all ages. And what is health? Health is not just physical and psychological being, but it's associated with a sense of vitality, a sense of feeling energetic. And if your vitality is down, then there's something that's down in one of these 6 health domains. Okay, I start with physical activity, but the thing that we've done wrong in medicine is for too many years we've promulgated, these are national guidelines, 30 minutes of exercise 5 times a week, or 150 minutes of exercise. That's been the wrong message, because in the people you're talking to, men and women in the 30s, 40s, and 50s, in the throes of a lot of time pressure, as you express, and burnout, the last thing they want to have on their plate is, whoa, I got to put on this whole new regimen of exercise. I'll get to it, I hear it, but I'll do it manana. And then manana, the same thing comes up because the daily pressures are so great. Well, it turns out that the guidelines finally were corrected about 6 years ago, but not even the medical doctors, most of them know about it. And I know that because I speak at conferences and I ask doctors, are you familiar with the 2018 physical activity guidelines for Americans? These were guidelines published. And what these guidelines show is that any amount of physical activity, any amount, begins to improve health. And it doesn't have to be. We used to tell people that you needed 10 minutes, a bout of exercise, 10 minutes to get a health effect. And that's not true either. Even 1 or 2 minutes of a physical activity starts to improve health, which means if you just intentionally, let's say you live in a building with stairs, decide intentionally, I'll just walk the stairs up and down 2 more times today than I had to, you're getting a health benefit. So what I tell people is I want to get them on the playing field to do something. I want psychological success, not aerobic success first. So what I do is say, can we come up with some sort of activity snacks or exercise snacks, some things you can do for 5 minutes a day, and to get a commitment for that 5 minutes. And the reaction will be usually, oh, come on, doc, that's like nothing. It's not nothing. It's really big. And many people fail to do that because they're not really committed to their health yet. But when you get them on the playing field and they're walking the 5 minutes, one day they went 10 minutes. And they say, another day we ran into a friend and they walked for 20 minutes. They had an insight, hey, I can do this more. And they're thriving in success and it starts to have an effect. So everyone can do this and everyone should do this.
I love that. Tell us what you feel like. You've been in this for 40 years. What do you see as the future of health as we look into the next 20 years, 30 years? What do you see coming? What do you see that people right now in their 20s and 30s should be thinking about, and doctors should be thinking about as we move into this? Okay, it's not just the medicines, it's the working out, it's the it's taking the 5 minutes every day. It's looking at these new guidelines, it's looking for these moments, these tuning for moments. What do you see coming down the pike as you look at the future of medicine, and especially in the area that you're in?
Well, we face a challenge in that regard because the good thing is medicine continues to improve and improve. That's the nature of medicine, technology, and so forth. And with that comes a blessing. People are living longer. We don't bat an eyelash today if we heard someone had their 90th birthday, or even if they're exercising at 90. But the fact is that with that comes an extra challenge. What is my health going to be like when I'm in my 80s and 90s? We have to worry about things like frailty and people losing the ability to use their muscles and all these things. But you're not going to think about that when you're 20 or 30. It's not going to happen. And this is the problem where we have not defined health properly, because health is not just the absence of disease. It's about that sense of vitality and feeling energetic. And when you have it, it's activating. And what we need to do is speak to people about the current benefits of health, the benefits of exercise, resistance training. A good diet makes you feel better emotionally. You're better on your game. You're working with people who want to be high performers. Okay? When you look at athletes, they know I got to be a little bit like Tom Brady, right? I've got to do things to keep myself sharp. So the same things that promote health promote optimal performance and resilience. And the physical things and the working on the quality of your thinking and so forth. And I would say that people like you who are dedicated to helping people to improve their performance are really also at the cutting edge of health. And we want that to be occurring before people come to doctors. We want people to come to doctors later. Doctors basically function in the curative fashion. And that's what we want them to do. But we want people to get healthy for the present benefits of being healthy. That has to occur outside the hospital by people who are seeing the interconnection between all these factors together and my health.
It's almost like when I was growing up, you just go get a doctor and you get some medicine. Now it's, no, you start working on your health yourself. It's not the doctor's response. You start working on it. And the doctor's there to guide you and to give you some pep talks along the way. And to me, that's where we're going. That's where I feel like I'm going with my health. It's like, I'm going to do as much as I can to have good health. I'm not going to not have good health because I know it's going to help me live longer and it's going to help me do all the things that I want to do. But I think when we delegate that to somebody else is when we don't, like you said, I was thinking about the athlete, the Tom
Right.
Brady's of the world, even just coming off of the Olympics, watching the Olympians and how they had to work on their own health, but they had different coaches around them. The doctor's just is going to be another coach in our life that's guiding us and
Right.
checking on our diet and checking on the things we're doing and not just giving us medication. Is
Right.
that what I'm hearing?
Yes, that's absolutely true. The problem is that, let's talk about it from the angle of the doctor.
Yeah.
Because fortunately, doctors have become more interested in preventive health and preventive medicine. But in reality, doctors approach it, I'd say there's the high-hanging fruit, the low-hanging fruit. The low-hanging fruit is this incredible medicines, for example, we now have for treating hypertension, well, diabetes, high cholesterol, and now even, obesity medications for lowering weight, which is going to be a profound revolution. And these things are, aggressively used by doctors. What's the high hanging fruit? Getting people to change their health behaviors. Why is that high hanging fruit? Because it requires time, a certain expertise. The results are not as certain. And doctors don't really get reimbursed for that because it's time consuming. So
Mm-hmm.
it's a dilemma we have. It's the high hanging fruit that is not being addressed. And so people have to become self cognizant of what are the things in terms of health habits that I have to do. And the doctor can help them. They can, but it's a duality of a responsibility on the part of the public, on the part of health
Mm-hmm.
societies and doctors to figure out ways so that we can help patients better in terms of their health habits.
That makes so much sense. And are you seeing an improvement of heart health since you've started practicing until today? Are you seeing a decline or where are we in?
Yeah, we have seen a marked decline. If you look at heart disease was like a 20th century epidemic. And by 1970, 3 times as many people were dying from heart disease as from cancer. We have since brought down the age adjusted rate of death from heart disease by 70%. Same for
Wow.
stroke. And today, heart disease and cancer, it's not a threefold difference, they're neck and neck because we've brought down, this has been from the medications we have and better health habits and all the things we can do when people need stents or an ablation, things like that.
Mhm.
This is a tremendous blessing. So we've really had a lot of success.
I'm excited about that. I know my mother's 87 and her parents died in their 60s and 70s of heart
Right,
disease.
right,
And it's just exactly what you're talking about. It's like her generation got to live longer.
right,
So I'm hoping that the next generation gets to
right,
as well. So it's
right,
exciting.
right.
So as we get ready to close down, as you're thinking about these people in the workplace right now, suffering the burnout, suffering, just can't get off, can't just right now, health's not a priority. They're just trying to get through the day. What is one thing that's coming up for you that you want to make sure they hear from you as they're thinking about their health and their heart health and just how to take better care of themselves in this season of really workplace burnout?
That's an important question. And I think for your specific audience, one thing we haven't touched upon is how our well-being and our performance is also related to the time stress we have, which is
Mm,
also a kind, we have so much more on our plate. We handle so much more data per day. We are multitasking more, and you're
mhm,
taking care of a mom who's 87, you
mhm,
know, and maybe 97, hopefully, maybe
mhm.
107, God willing. And so that's an extra responsibility you didn't have. So I think one of the mistakes that people make is they get into what I call a radical build. They say, wait, I got to get this job done. And what they do is they say, you know what, I'll put off exercise, I'll put off that diet I was going to talk about, I'll put off getting together with my friends because I want to get this kind of project done. And what happens when they focus on just the project, things begin to happen. They get more successful. But what
Mhm,
happens is that radical build is so tasty that they
mhm,
often stay in it, not for a couple of weeks and not for a couple of months, but I find for a couple of years and sometimes even a couple of decades, where they
mhm.
get out of life balance And so what we have to say is this radical build is like nuclear energy. It can empower you to be very successful, but you have to time limit it and you have to commit to life balance. And that's not simple, but that's the key to monitor that in yourself and make sure you have a core amount in each area of your life, like physical activity. Maybe I committed to exercise. Now, if I'm not doing that, at least I have my exercise snack. Same with your diet. And if you do that, you're more likely to be successful in the long term.
I think that makes so much sense. It's that activating and just getting things done and not really thinking about themselves, but just getting it done and just staying in that hamster wheel that's causing a lot of this. And I think when we have leaders that are doing that, then the people underneath them see them doing that, and then it's just it just keeps, it's a cycle. And it's like,
Sure.
wait, somebody stop this, because the companies are paying more for healthcare, more is a lot of things are affected by that. And so it's stopping the cycle. So I love that. And thank you so much for just bringing that to our attention. I love the work that you're doing and how you've been working on advancements in cardiology for 40 years. And we're seeing a drop in the amount of heart attacks and amazing health coming out of the research. So thank you so much. Very excited to share you with our audience today. And even if they just did one thing today, just one thing I heard would be take 5 minutes and do a little extra step. Go walk around the block. Anything that you can do for just to start, right? For 5 minutes.
Yes, absolutely.
Start small, right? So
Absolutely. That's the key.
thank you so much. And just tell the audience how they can get a hold of you if they want to reach you or just follow what you're doing. Is there a specific place you would recommend that they connect with you?
Sure. Well, first of all, if you go to a website called PubMed and you type in my name, you'll come up to articles. And last year I wrote a series of articles. They're all open access that are about these very topics and other topics related to health. In about 2 months, I'll have an active website, which I'm currently
That's exciting.
constructing about this very issue, because I've all my life been teaching residents, fellows. I've been in medical education, but now I want to make sure the public's getting this more clear and clear. And also, I got a LinkedIn site, but it'll be more active in the near future as well.
That's great. And you said it's called PubMed?
PubMed, yeah,
PubMed. Okay.
PubMed, yeah, yeah.
Okay, PubMed, and then we'll just type in Dr. Rozanski, and we'll put all that in the show notes. Thank you again for being here with us today. Thank you for sharing your wisdom. I'm so excited about you taking what you've been teaching residents and doctors now and getting it out into the world and sharing those secrets that they really aren't secrets, but they're great tips. So thank
Thank you
you.
so much. Thank you for having me.
Sure. Right. Let me stop the recording. There we go.